This is Damian McNamara from Elsevier Global Medical News, and I'm here at the Perspectives in Rheumatic Diseases meeting in Fort Lauderdale, and I'm here with Dr. Daniel Furst, who's a professor of medicine and rheumatologist at UCLA. Thank you for joining us.
Thank you.
My first question is, one of the main themes of this meeting is collaboration between dermatologists and rheumatologists, and in fact you're giving a talk to that effect. Could you explain why that's so important?
Yeah, the particular talk I'll be emphasizing is that on scleroderma, which in fact presents as a dermatological condition. The skin gets hard, and the patient often goes to the dermatologist first. It turns out, of course, that this is a disease that's immune-mediated and affects the internal organs.
Okay, so the first signs are cutaneous, and that's often where patients are first diagnosed and then referred to a rheumatologist? Is that
correct? And the rheumatologist and the dermatologist should be working together on the shall we call it, the external and internal aspects of the disease.
So you're saying if the care is coordinated, the outcome is better for the patient?
I believe so. Scleroderma is a systemic disease. So we collaborate with the pulmonologist, the GI doctors, the cardiologist, and the dermatologist in taking care of these patients.
So it's a true multidisciplinary approach.
Yes. Well, at this meeting we're going to be talking about psoriatic arthritis, and of course psoriasis is a disease that affects in a major way the skin. So there has to be a good deal of interaction. I think that when one deals with inflammatory bowel disease, there are a good number of dermatologic presentations of that. In fact, it may be the first presentation of inflammatory bowel disease. So, and then we'll be talking about lupus as well. And lupus often has very major dermatological aspects to it.
What would be your take-home message, you would say, from sort of this collaboration talk you're going to give? What would you say if you had all the doctors from all these particular specialties deal with immunologic-based diseases together? What would be your take-home message?
I really do believe that the dermatologist and the rheumatologist each has their area of expertise, and we have to work together in order to do the best for the patient.
If there is a turf battle between the dermatologist and the rheumatologist, what do you think of that?
I think this is regional. At UCLA at least, the dermatologists tend to take care of the psoriasis more than we do, and yet they refer patients to us when the patients develop other aspects of their disease. On the other hand, we tend to see an awful lot more of the lupus, but we send our lupus patients to them when we have difficulty with their dermatological problems. I think that sometimes we see patients, and I can think of a young woman who came in with a rash that I really wasn't sure whether it was eczema or psoriasis. Of course, those have very different treatments and different prognoses. And by sending the patient to the dermatologist, he could clarify for me and in fact start treating, so that I could treat those aspects of the patient's disease that were my area of specialty.
Thank you very much for being with us, Dr. Furst. This has been Damian McNamara reporting from Elsevier Global Medical News.